Good afternoon. My name is Dr. Doe. I'm thinking to make this video for a while, but I just do not know where to start. I've been thinking from head to toe and eventually came up with this idea. From head to toe, the most common symptoms, and I listed alphabetically. So for example, I start from A, abdominal pain. So let's start from abdominal pain. I do not have any handout, no manuscript, I just talk. Okay, I may miss something, but I'll catch up next time. Okay, talk about abdominal pain. First of all, let's talk about the abdomen. Usually when we talk about abdominal pain or abdomen, we divide it anatomically to the 9 regions. Okay, if you make a line, 2 lines, vertical and horizontal, so will be 9 regions. For example, I said right upper quadrant, or lower right lower quadrant, okay, or the center, or the middle upper middle abdominal pain. Okay, so it's located next to the sternum. Okay, usually when we talk about abdominal pain, if you talk to your physician, you need to tell the physician where is the pain. Okay, for example, I have right upper quadrant pain. Okay, so the physician knows where it's located, or you point it to here, so the doctor knows where is your pain located. And then you describe what kind of pain it is. Is it colic, or it's a dull pain, or it's a sharp pain? And then doctor has idea, because different type of pain could be caused by different etiology. Okay, so after you address that location and the nature of the pain, and you talk about the in terms of tempo or time, is it a constant pain or is it intermittent pain? For example, I have a dull pain here constantly, okay, or I have the pain here comes and goes. It's called intermittently, because again, different presentation has different causes. So after that, you talk to your physician. The doctor might ask you any other associated problem with your pain. Okay, so then you say whether you have nausea, vomiting, okay, and anything triggered, anything brought the pain. For example, you might have eaten some leftover rice or chicken, or you just exposed to some cold or any, or just no reason, the pain just started after I woke up. Okay, so these are basically, when you talk to your doctor, you need to make clear, so your doctor knows what is your problem you have, and you give the information as much as you can, save the time for the doctor and also for you. Okay, so now you talk to your pain location, the nature of the pain, and how it started, and then the doctor might ask you any other symptoms, like generalized problem. You have fever, any other problem, diarrhea, nausea, vomiting, fever, headaches, anything like this, or have you traveled anywhere and any food allergy, something like this. So give the doctor an idea of the knowing where is the pain. They will narrow down what organs there, what the cause for the pain over there, and the nature of the pain. And further for that, the doctor might ask you, or you might tell the physician, oh, I had a surgery, by the way, I had a surgery 5 years ago, open abdominal surgery, and the doctor right away think about, oh, probably it's obstruction. Okay, and you further say, oh, I haven't had bowel movement for a couple of days. So put things together, the physician has idea what is the pain. Okay, what is the cause of the pain, and then either do some test or send you to the emergency room or talk to the surgeon and to do the relevant treatment, efficiently management. Okay, so talk about the abdominal pain in general. The physician will ask you, one, or is it like acute or is it chronic? There's a time, usually 6 weeks. Okay, so if you have the pain, abdominal pain, for 6 weeks, that's called chronic. Okay, it's not acute. You have it, comes and goes for 6 weeks. If you have this, if you talk to the physician and said, I have this like upper middle abdominal pain for for 8 weeks, just comes and goes and bothers me sometimes, especially when with food taken or with empty stomach. So this also bring up to the idea the doctor knows, when the experienced doctor will know, okay, so you're talking about this middle upper abdominal pain, and there could be in the empty stomach, which means gastric, very likely gastric ulcer, or you said 3 or 4 hours after the meal, which is empty stomach, that's from duodenum ulcer. So these are just the fundamental idea of how you describe your pain to your physician. Again, I just summarize for this. This is the first time I made this video, and I'll make summarize for what we talk about today. Generalized, just from the beginning, abdominal pain. How do you present your pain to your doctor? How you communicate yourself? First of all, you say, where is the pain located? And then you say the pain location, either upper, middle, abdominal, or right lower quadrant, or right upper quadrant, or just middle around the belly button, umbilical area, or left lower quadrant. Okay, and you talk about the location, then you talk about the nature of the pain. Is a colic, it's a constant, it's a dull, it's a sharp, or it's a throbbing. It's just like something's pumping there. Okay, so that's nature. And then you talk about the onset, which means when did the pain start? And the triggering factors, what triggered the pain? The food, or just the coldness, or just no reason, the pain just started by itself. Okay, and then you talk about the associated problem, like whether there's a fever, nausea, vomiting, or have you had any medical problem, any surgery, something like this. You put this together to your physician so your doctor knows what caused the pain, and further to either decide send you to the emergency room or to draw the blood after the doctor examine you. Okay, this is the first video I make. I'll just check it to see whether it's useful.